Okay, welcome everybody to My Health Record for Medical Specialist Practices Optimising Patient Care session today. Before we get started, I'd like to do an acknowledgement of country. Northwestern Melbourne Primary Health Network would like to acknowledge the peoples of the Kulin Nation as the traditional custodians of the land on which we're meeting today. We recognise their continuing connection to the land, waters and culture, and would like to pay our respects to elders past, present and emerging. Before we get started today, we'd like to do some housekeeping. So all attendees are muted, so please keep your microphones on mute. Please ask questions via the question box. Q&A will be at the end of the presentation today. This session will be recorded, so questions will be anonymous to protect your privacy. Northwestern Melbourne PHN will be taking attendance, so please ensure your name in the Zoom meeting is the same as when you registered. Also, this session today has been approved by the AAPM, so 5 CPD points will be allocated. And we're excited to announce that we've got some upcoming My Health Record sessions for medical specialist practices in May. So we've got the Getting Connected to My Health Record step-by-step for medical specialists. And we also have Understanding Privacy, Security and Consent. We will be holding these sessions in partnership with the Eastern Melbourne PHN. So we're really excited that we have organised these, and more information will be coming soon. Registrations will shortly be on our websites. We'll let you know when they are through our comms. And I'd like to introduce you to our speaker today, Sama Omar. Sama Omar is a digital health educator at the Australian Digital Health Agency with over 10 years experience working in the healthcare industry, including roles as a pharmacist manager, locum pharmacist and an aged care pharmacist. She's passionate about implementing the use of digital health technologies across multiple healthcare settings to optimise patient health outcomes. Thank you so much, Sama, for agreeing to present for us today. And I hand over to you now. Thank you.
Thank you, Sonia, and thank you for having me as well. And thank you, everyone, for your time today. So I'll just share my screen. Okay, so I'd also like to acknowledge the traditional owners of the land. So I'm joining from Sydney today, which is the land of the Gadigal people of the Eora Nation. So basically, these are the outcomes I hope to achieve today for you all to have a better understanding of what the My Health Record is, when you can use it, or your specialist can use it in practice, the benefits of My Health Record, again, when you're using it in practice, also the key information that can be found within the My Health Record system. And we'll also touch on policies that you need to have in place within the organisation in order to be using the My Health Record system, and also looking at how we can integrate it into workflow. So just for a bit of background, My Health Record is one of the core components of the National Digital Health Strategy. And the sort of aim of this strategy is to help improve health outcomes for Australians. So there are 7 key areas of this particular strategy. And as I said, My Health Record being one of those core components. And essentially, the concept is about having health information available whenever and wherever it is needed. So just to give you an idea of how sort of My Health Record engagement is tracking across the nation. So we have these figures as of January of this year. There's more than 23 million Australians that have a My Health Record. So that's more than roughly about 9 in 10 Australians. And now the amount of data or information within these records does vary depending on the complexity of the person's medical sort of history, or the number of medical professionals they interact with throughout their healthcare journey. But again, the more than 20 million of these records will have data in them. And also, oh, sorry, I thought we had, 1 second, it's probably okay. Sorry, that's coming up. We'll see how it's tracking with the different healthcare professionals. So again, just what is My Health Record? So essentially, it's an online summary of an individual's key health information. So we do stress that it is a summary. It's not designed to be a complete record or to replace any existing records, but more so to be used as a complementary source of information that previously wasn't available. It's personally controlled, so it is up to a person whether or not they have a My Health record, as well as what's in their record and who can access their record. And I'll touch a bit more on these controls later on. It's also part of a national system and it's accessible at all times. So again, just making that accessibility that much easier. So whether a person is traveling interstate visiting friends, or they may be at home, but it could be after hours, or again, in the case of an emergency setting, their health information is pretty much going to be at their fingertips or the fingertips of the healthcare provider. And then given the nature of the sensitive information within a person's My Health record, so, you know, all their health information, quite sensitive information, it is quite heavily protected. So there is legislation specific to the My Health record that protects the information within there and ensures the users of the system are using it appropriately. We also have other security mechanisms in place, such as audit processes, firewalls, secure logins, and there is a conformance sort of process that a system needs to undergo before it can connect to the My Health record system. So it's not just any system that does connect. You know, once that process is in place, there's certain requirements that need to be met, and then it can connect. And we are looking to, you know, we do certainly provide support to software providers who do want to make their system conformant to connect. And at the center, the agency, which is the system operator of the My Health record. So at the agency, we have a cybersecurity center that monitors the system 24/7. So, and that's again sort of ongoing, no days off there, and any misuse of the system, and we're referring to like any deliberate misuse of the system, is associated with penalties. So here, just to give you again an idea of how My Health record is, you know, again, the how it's tracking or the engagement across the different healthcare settings. So as you can see, in the space of pharmacy, general practice, as well as public hospitals, we do have, you know, more than 95% use of the My Health record. So on the screen there, you can see the registration numbers as well as use. So we are very much about not just, you know, getting people registered, but also making sure they understand when and how they can use it. And in the specialist space, which we're now, again, sort of doubling all our efforts along with the PHNs to offer support, we do at the moment have 20% of specialists that are registered, with 9% actively using the system. And again, we're hoping to see these numbers grow over time. So now, also just before we launch into the functionalities, sort of the specifics there a little bit, just to give you an overall picture of the benefits that will be available or will be made sort of possible through the use of My Health record, just to keep in mind as we go through the different documents. So essentially, it's again all about sort of that time efficiency. So giving you access to key health information and not having to do that in a time-consuming way. It's also a great administrative tool. So again, not to add to what can I imagine is already a significant workload that you would have. And also having access to that information does reduce or avoid the duplication of services. So we see that happening a lot when it comes to scans and diagnostic images being requested more than once because of not being able to track the results. So again, we can see that significantly reduced by having these results available on the My Health record platform, and also access to information that the patient themselves can share to help inform end-of-life care decisions. And this is, we're referring to an advanced care plan, which can also be housed on the My Health record. So on this picture here, this pretty much summarizes the information that you can see within a person's My Health record. Now, there are three main sources of information. So on the left-hand side, we have, on the right-hand side, we have the consumer documents and the Medicare documents. So consumer documents are those that the patient themselves shares. So as I mentioned, that could be an advanced care plan. It can also be emergency contact information, as well as a personal health summary. Then we have information coming from Medicare, and that could be Medicare services that have been claimed, as well as previous claims. A person's organ donor register status can be viewed on the My Health record system. So they can't actually set their status through My Health record. It's just to view what status they already have selected. And then we have information from the Australian Immunisation Register as well. Now, the bulk of the information is going to be that coming from the providers, and that's what we have there. We have shared health summaries, pathology reports, specialist letters, and a whole range of other documents as well. What we can see in the center of this particular image here, so we have 5 what we refer to as overviews. So these aren't separate documents that get uploaded to the system, but these are system-generated views that extract information from the documents that have already been uploaded, and they just they extract that information and they sort of consolidate it into a really easy to view format. And again, that's all about enhancing how quickly and efficiently you can access that information. So for example, this top one here, the medicines information view, we'll have a look at that a little bit more closely. So what you can see here is what it would look like on your screen. So the medicines information view has 4 key areas that you can see along the top. So there's an area specific to allergy and adverse reactions information. And again, so that's one of the main things you might want to find out about a patient. It could be someone that you've never seen before, or someone who has recently developed an allergy and that you haven't been made aware of. So you can track that in this particular view. Then we have a specific section within this overview that's referred to as the medicines preview. Now, any medication-related information will be available in this section over here. What you can see in this list here is a list of all the separate documents that might contain medicines information. But again, instead of having to look at all these separately, this information is, again, just consolidated into this view over here. So if we look at the list underneath, we can see that medicines information has come from an event summary, but then we can also see a different source where it's come from, which is a shared health summary and a prescription record. When you click on any of these hyperlinks, you can then be directed to the original document. Again, if you wanted to view that in a bit more detail. You can also sort this particular list by the active ingredient. Again, so just another sort of user-friendly option instead of having to rely on the brand name of the medication. Now, from within this same view, we're able to access the shared health summary. This is a really useful document that can help, again, give you an overall picture of a person's health status. And then any recent discharge summaries would be made available here. Now, you can also access them outside of this medicines view, but again, just to show you, there is more than one way, so you don't need to click back and forth too much if you don't need to. This next view is the immunisation view. So this was introduced to the My Health record system last year at the beginning of the year to help support the COVID-19 vaccination rollout. We had a lot of great feedback from practices about this particular view. So as you can see, it's designed in a similar way to the medicines view that we just saw, in that it has also 4 areas at the top to help navigate your way through that particular view. So the default display is the Australian Immunisation Register. So any information that's available on the Australian Immunisation Register can flow through to the person's My Health record. So in addition to a list of their immunisations, the date that they had the immunisation, as well as the brand of the immunisation, you can also see their immunisation status. So both their COVID-19 immunisation status, as well as the immunisation status that's part of the National Immunisation Program. I know if there's been any notices, such as any exemptions that have been recorded in AIR, that can also flow through to their My Health record. Now, keeping in mind that not a person's immunisations might not have all been recorded on the Australian Immunisation Register, because previously it wasn't mandatory. So it is mandatory now, or as of July last year, but for anything prior to that time that may not have been recorded in AIR, it still may be housed within their My Health record in the form of either an event summary or a shared health summary, which are two different types of documents. So this second tab here, the immunisations, again, just gives a more comprehensive list, because it will incorporate immunisations from AIR as well as immunisations that are within the person's My Health record. So next here we have the pathology and the diagnostic imaging reports overview. So the screenshot that you have here is for the pathology reports overview, but the diagnostic imaging reports one would look quite similar. Now, we have a link that we've shared at the bottom of this screen that you can visit this webpage to see which pathology and diagnostic imaging providers are uploading to the My Health record system. So that webpage is sort of broken down by state. There are some providers who have certain requirements before they do upload to the My Health record system. So one of those requirements might be that they require the request to be in the form of an e-request. But again, that information is available on the webpage. But what you can see from the overview and what it looks like is, again, you can sort the results by the test name or by the date that it was collected. And then again, you can click on the hyperlink and that will show you the report. So the results can still be sent, as per the current practice through maybe, for example, secure messaging or whichever other practice you use now. But there is also now this additional option to have a look at the My Health record. Now, one thing to mention here is that any results that are uploaded to the My Health record system, the patient can also see these results, but they won't see them till 7 days after they've been uploaded. So that first 7 days gives sort of exclusive access to healthcare providers to be able to view the results and give them time to decide on what the next steps they want to be are. So this is the final one of those automatic overviews from the system, which is the Medicare overview. So on the left here, we have what it looks like. So there's 4 key areas over here. So we have the PBS and RPBS information. We have information coming from AIR, and then the Australian Organ Donor Register information. And then this last section is what we've zoomed on here. This may be of particular relevance to specialists, where they can have a look at which Medicare services have been claimed for the patient. So they can see which service was claimed, when it was claimed, so that they can have an idea of when their person might be next eligible. And they can also see who claimed for that service, again, to give them an idea of who else is involved in that person's care. So now here, this is the separate documents that get uploaded to the My Health record system. So we had a look at the overviews that extract information from the documents, but now just to give you an idea of the individual documents that do get uploaded. So we have this document called the Shared Health Summary. So again, it's really useful in that in a lot of cases, it may be one of the first that you may access. So again, especially if it's someone that you've never seen before, it's designed to capture their health status at a point in time. So 4 key areas in that shared health summary are the adverse reactions, the medications, the medical history, and the immunizations. And then at the bottom of the document, you can see who's authored that particular document. One thing to note about the author of this document is, again, this is outlined in the My Health record legislation. The author of this document, it's not going to be, multiple healthcare providers. It's going to be the person's nominated healthcare provider. Now, in a lot of cases, this might be their GP, but we have seen cases where a person might wish to nominate, for example, their oncologist instead of their GP, whoever they would see the most. And it doesn't need to be written consent. It's just sort of that mutual agreement. But basically, that nominated healthcare provider will upload this document, but then this particular document can be viewed by anyone that's accessing the person's My Health record. This next document here is an event summary. So with this one, any healthcare provider that has a HPII, which is a healthcare provider identifier number for the individual, and this number is more or less an extension of your APRA number. So anyone can upload an event summary, and again, this document is designed to capture any significant event that's relevant to the patient's ongoing care. So the type of event recorded in this document, again, can vary depending on the healthcare setting. So we see, for example, a lot of allied health might want to use this to document certain things about the person's treatment. But then again, a GP might use this, for example, if it was an after-hours GP that the patient saw and they wanted something that they thought was relevant to be in there. So again, that's also viewable by anyone who can access that person's record. And again, there's that section at the bottom to let you know who uploaded that particular document. So a key thing for specialists, again here, is that you can have the specialist letters uploaded to the My Health record system. So on the screen here, we have two examples of what that letter may look like when you've uploaded it. So again, you can continue to send them as per your normal practice, but again, you have this option here. And again, it's all to help improve that continuity of care for patients, just in case that letter was to get lost, for example, or misplaced. Or you can also see this as an opportunity to save time and money to having to fax or post the letter. So we've seen those main documents in the My Health record system. Now, just to zone in on a little bit on when you can access and the My Health record system for your healthcare providers. So a healthcare provider is able to access a person's My Health record as long as it is for the purpose of providing care to that particular patient. Now, this episode of care, it can be, it doesn't have to be at the point of care. So it can be before, during, or after, but it's all relative to that point of care. Now, we do get asked a lot, like if you need permission from the patient to access their record. But again, you don't actually need the permission or the consent. So again, outlined in the legislation is as long as you are providing care and you're authorized by the organization. So for example, your organization is registered for My Health record, you're linked to that organization, then you have the authority to view. And the same applies to uploading a document as well to their My Health record. Now, it is best practice to let your patients know that you do use the My Health record system. And of course, they have they are able to request for a document not to be uploaded to their system. And in the case where that request has been made, then again, a condition of your registration with the My Health record system is to comply with that particular request. And now I mentioned the patient can have some personal controls applied to their record. So just to touch on those a little bit, but also keeping in mind that it's 2 in every 1,000 people that we see do set access controls on their record. But just so that you're aware, so a person can restrict access to their whole record, and they would apply what's called a RAC, or a record access code. Or there's the option where they can restrict just certain documents within their record, and that's referred to as a LDAC, or a limited document access code. Now, where a person has applied a RAC, when you try to enter their record, there will be a message popping up on the screen that says there's an access code set on this record. And in that scenario, yes, you would need to ask for that code to be able to access their record. And the other thing to sort of keep in mind here is once that code has been supplied to you, so if this is an organization with more than one specialist in it, once that code has been supplied to one specialist, it's given, the access is given at an organization level, and that's valid for 3 years, unless that person was to sort of change their access controls again, which we don't see happen, but just for you to be made aware of. Now, if there's an emergency and you need to access someone's record and they have set an access code, then there is an emergency access sort of provision or function that you can exercise, which we'll touch on next. But also some other patient controls they have is they can choose to receive an SMS when their record has been accessed for the first time by an organization. And there is also an audit log that they can view within their My Health record. And similar to the practice within the software, you'll also be able to check an audit log again to see which staff have accessed the My Health record system. So with the emergency access provision, again, it is quite particular when this can be used, and it may not be relevant to your practice. Of course, maybe in the hospital setting, this is something they might sort of be more aware of. So when in this situation where there's an emergency and the clinician believes that access to the person's record is necessary to lessen or prevent a serious threat to their life, health, and safety, and they're not able to obtain the consent or the code from the person themselves. So that's one scenario where they can then choose to use the emergency access, or it can be in the case where access to the information is necessary to lessen or prevent a serious threat to the public's health or the public safety. So if either of these two criteria are met, there will be an emergency button that can be clicked, and that will then grant 5-day access to the information within that record. And as with all other instances of access, that will be visible on the audit log. So now to touch on how you're going to access it in your private practice. So we have two ways that you can access the My Health record system. So one way is through your conformant clinical information system. Now, again, we do have a number of the specialist software that are conformant. There is a link there to the Register of Conformity where you can have a look if yours is conformant or not. Now, one of the great things of accessing through your clinical information system is it's integrated within your system. So again, it makes it embedded into your workflow. There's no need to open up a second browser at all. It's within the patient's clinical file. There will just be an extra icon that you can click to then enter in their My Health record. Now, access this way gives you full functionality. And when I say full functionality, I mean you have the access, the ability to view information, as well as to upload information if you wish. Now, if your clinical information system isn't yet conformant, or for example, you just haven't set it up yet, there is the option to access through the National Provider Portal, which you can see the second option there on the screen. Now, a key difference to note between these two ways of accessing the My Health record is that the National Provider Portal, you access this through a browser. So you'll need to open up another browser on your computer, and you will need to have a Provider account. So Provider or Provider Digital Access. You would need that account, and then you'll need to link your link it will be linked by your organization to the My Health record, in order to then view the person's My Health record. And also access to the National Provider Portal. It's just a view-only access, so there is no option to upload information when you view or when you access that way. So that's basically, I think, all really about that. What I can show you next here is the agency, is partnering, as I mentioned, with a lot of software providers to help them complete designs to enable that seamless integration with the My Health record system. So you can see here we have a number that are in general release at the moment. We have a few in beta release, so they're just in a few test sites. And then we have quite a number of softwares that are in the development phase that we hope to see in general release come the next financial year. Okay, so I thought I'd just step you through the process of how to upload a specialist letter. Now, I will be using Genie to demonstrate today just because that's what I have available to me. But again, it may be slightly different in a different software. But just to show you what it's like when creating the letter, so it'll be the same steps that are usually followed to create the letter. And the only additional thing now is that at the top of the screen, there will be a box that's ticked by default that will say send copy to My Health record. Now, if you don't want this to be on the My Health record system, or the patient has requested for it not to be, that box can easily be unticked. So once that box has already also been ticked, there's also the next sort of box to be ticked will be either one of three, so either ready to send, or if it's just been reviewed and then you want maybe your front desk staff to send it later. And then in the instance where you want to have it printed, so you would click any one of those boxes in addition to the send copy to my health record, then you will press save. Then you will see once it has been sent to the my health record, the box that says send copy will change to sent to let you know past tense that it's been done. The other thing to point out, again, is if you have uploaded it to the My Health record, just as easily you can remove it, again, depending on for whatever reason. You can right-click, and then you have the option there to remove it from My Health record, and that will be removed. What I also wanted to point out, let me just see if I can share that across. So we have on our webpage clinical software summary sheets. So at the moment, in terms of the specialist space, again, we are looking to add more, but we have these two at the moment where you can have a look at all the different functions or how to view those different documents that we just went through. So again, that's available just 1 to 2 pages, really concise, step-by-step with screenshots, again, just as an added resource for you. So again, just to sort of summarize those benefits of having that My Health record enabled software. So as you can see, you can easily view all the documents and all the overviews from within the person's clinical file. So, you know, it's not like a separate browser when you're using your software. And the specialist letter, as you can see, it is supported quite easily. And you still have the assistance of your non-clinical staff if needed, if you wanted them to upload the letter after you've reviewed it. So again, you have that option available to you. And also just to tie in those specific documents with separate tasks that you might want to do. So when you're taking a history for a patient or first assessing them, just, you know, a reminder, the documents that might come in handy there are the shared health summary, because again, it captures all that main or key health information. Any discharge summaries that are available on the record can also assist, you know, when you are doing a historical assessment for a patient. Anything related to a medication reconciliation task, or if you wanted to, you know, when you're coming to prescribing a medication, again, you have that medicines information view that lets you check out what the allergies are. So to keep that in mind when you're prescribing, and what other medications they may already be taking. And we've seen that the pathology and diagnostic imaging reports, having those available and accessible on the My Health record, can avoid the need for you to have to request any duplicate tests or scans that may not have reached you in time. So now to touch on sort of the logistics of it, how to get connected. So one of the first things you do need to keep in mind when you do want to register for the My Health record system. So even before you complete the registration form, your practice needs to have a security and access policy in place. So this is outlined in the legislation, and it is a prerequisite. So there are some templates that are available that have been put together by some peak bodies. So again, they're available. You have a copy of these slides after the session, and you can click on those hyperlinks and have a look. So you can just use those templates as a guide and then tweak them to suit your organization. And one key thing about this policy, once it has been sort of finalized, it needs to be clearly communicated to all the staff within the organization who are going to be accessing the My Health record. And at a minimum, this policy will be reviewed annually. Now, it can be more so if circumstances arise, but at a minimum, it is annually, and there will be a version control implemented with this particular document. And this document is also going to outline the two key roles, which is the responsible officer and the organization maintenance officer, who will be largely involved with the My Health record use within the organization. Here again, just to summarize key things to consider when you're registering for the My Health record. So once that policy has been implemented, that's when you can then look to register, and you'll need to have the PRODA account and also link your PRODA account to HPOS in order to complete that registration process. Now, training for staff, again, there is no sort of minimum requirements, but it is recommended that it is ongoing. So there's a variety of resources available. So they can, there's e-learning modules online. We have also like previous webinars, or we have those summary sheets they can print out and have a look at. But basically, once they have undergone training, there is like a training declaration that you should get them to fill out, and that's when they'll be ready to use the system. And again, we do have a training checklist, a recommended training checklist that we can share with you, again, that you can alter to suit your organization. And also making sure that you've confirmed how you'll be accessing the My Health record, so either through your clinical conformance software or through the National Provider Portal. So that will also be outlined in your policy. And ongoing participation obligations just refers to the responsible use of the system. So making sure that you're accessing for the right reason, so for the purpose of providing care, and making sure that if you do upload information to the system, that to the best of your knowledge, this information is accurate at the time of upload, because keeping in mind that this information may be relied upon by other healthcare providers, and certainly not discriminating against anyone who doesn't have a My Health record. And if for any reason your organization is no longer eligible to participate in My Health record, then again, that's alerting the system operator. Now, in terms of helping out with getting started and getting registered, so we do have a specialist connections team at the Digital Health Agency that is dedicated to providing you step-by-step support along the way, because registration can be like a multi-day process. So you have support available there. Again, you have your primary health networks representative that is also available to offer support. So definitely you are not alone in this, and lots of support available, and just a matter of reaching out. So other resources just for you, you may already be aware of, but just again, just a recap. So we have the Digital Health Specialist Toolkit. So within this toolkit, there's lots of videos, lots of printable guides, and then also you have access to the training website that has the modules and the demonstrations, as well as any podcast, if that's your preferred way. So that's everything from me today. So I hope that did help, clarify a few things in terms of My Health record, or for those that didn't know anything, I hope it was a good way to introduce you to the My Health record system. So again, we have the My Health record helpline. Just to mention there, it's available 24 hours, 7 days a week. And again, there's a dedicated option there for providers, and any other sort of inquiries you have related to any other digital health tools, we can also help you with that. And there's a agency helpline number on the screen for you there as well. So I'll pass on back over to Sonia.
Thank you so much, Sana, for that great overview of the My Health record. Some really good information was provided in your presentation today, so thank you so much. We don't seem to have any questions on our chat at the moment. If you do have any questions now, if you'd like to add it into the chat, we're more than happy to answer any of your questions. In the meantime, while we're waiting, if there's any questions, for those who have missed our introduction at the beginning of the session, my name's Sonia Zara, and I'm your digital health support person here at the Northwestern Melbourne Primary Health Network. So please give me a call if you do need any assistance with registering for the My Health record, or if you would like any information on the My Health record. This session also is being recorded, as we said, and if you have your colleagues in your practices that missed out on the live webinar today, we can have this available for them, the recorded version as well. yeah, I guess there's still no questions at the moment, Summer. But look, if there are any questions, please send them across, email them across to us. We have an evaluation that you can complete out as well at the end of the session that will be sent to you electronically. So we really would appreciate your feedback on today's session. And yeah, I guess if you want to have a chat to me, you can contact me on the main number 93471188 at the PHN, or email me sonia.zara at northwesternmelbournepHN.org.au. You can contact me there. Or like Sama has jotted down here, there's also some contact details here on this page for further information and support. Again, thank you for attending, and looking forward to perhaps seeing you all at our next session, at our next sessions in May. So thank you. Thank you, Sama.
Thank you.
Bye.
Sonia, there was one last very quick question there, if we wanted to try and catch that one.
Yeah.
Oh, we did? I didn't see this.
It was very quick. It was from Ariza. Can you upload results into My Health Record?
So as a clinician yourself, if you wanted to upload results, no, not really, unless you wanted to put it in an event summary. That would be one way that you could do that. But there is, if you mean like a full report to upload, no, at this stage, no. What I might mention, sorry, I do get asked this usually, and I did forget to mention. So usually I get asked if someone has had a document uploaded to their My Health record, whether the specialist or the clinician gets like a notification. So that question does come up from time to time. So you don't actually, you're not notified of anything being added to the person's My Health record. Yeah, you won't know until you enter their record and then you see what's there and the date it's been. But outside of once you're outside of their record, there's no notification or such that's sent. So that's something that comes up sometimes.
I can't see if there's any other questions. Can you see anything at your end, Yvonne?
No, that's it. It was Ariza. She got in very quickly just as you were about to close.
Yeah, and I still can't see that for some reason, but that's okay. Thank you, Ariza, for your question today. And again, if there's any questions after we go today, please don't hesitate to give us a call or email us across. And do provide your feedback. I do see that Yvonne's popped the link there for the feedback as well. So please do fill in the survey there on the link on the chat there that's been added. Sorry,
I have just seen one more about what about patients who don't have a Medicare? So if they don't have a Medicare, that's fine. They do need to have an individual healthcare identifier number, which is an IHI. So when you're with Medicare, you automatically get this number. But if you don't have Medicare, you can apply for this number. So there is a separate form to apply for that number without a Medicare, and then that'll be fine. And I can pop a link in the chat that might help give you that information as well.
Is there any more questions before we go? Happy to unmute anyone if they would rather speak than write. Okay, it looks like that's it. Again, if you do feel that you have a question after the session today, please feel free to give us a call. Okay, I guess we'll leave it to there then. Thank you again for attending, and thank you again, Sama.